You're listening to Physician Non-Clinical Careers, episode 315. Develop these essential skills to be a visionary medical affairs leader. In this week's episode, we welcome back Dr. Savi Chadha, who first appeared on the podcast about 5 years ago. In fact, he was the very first medical science liaison that I interviewed. He's back to share what he's learned in these 5 years about becoming an MSL and about working as part of the medical affairs department in a pharmaceutical company. But of course, before we do that, let's thank our sponsor. The University of Tennessee offers the longest running and most highly respected physician-only executive MBA in the country. In fact, it's produced more than 700 graduates. I think I've interviewed 5, 6, 7 of them. I can't remember. But it really does a great job in getting you prepared for a leadership and management position. The Haslam College of Business at the UT was recently ranked #1 in the world by Economist magazine as the most relevant executive MBA program. And it's efficient. Don't get me wrong, it's hard work, but it only takes 1 year to complete. Graduates have taken leadership positions at major healthcare organizations and have become entrepreneurs and business owners. If you want to acquire new business and management skills and advance your non-clinical career, then contact Dr. Kate Ashley's office at 865-974-6526 or simply use our handy link at nonclinicalphysicians.com/physician MBA. Okay, non-clinical nation, I'm very happy to have Dr. Savi Chadha back with us. Medicine has always been a family business for Savi, as his mother, father, and sister are all physicians. After graduating from Loyola University in Chicago with a degree in marketing, he went on to earn his master's in public health from Benedictine University and his medical degree from St. James School of Medicine. He then chose to do a residency in psychiatry at Advocate Health Systems in Chicago. Savi started as an MSL in 2016 with Amplity Health and moved to a new employer in 2017, about a year later, where he remains today. After obtaining the necessary experience, he later became board certified by the Medical Science Liaison Society. And he is also on the faculty with SEEK and is a mentor at its annual meeting in Chicago in October, which is dedicated to teaching physicians about non-clinical careers. So you might look for that if you're looking for a 1 or 2 day meeting to go to where you can get exposed to, dozens of non-clinical careers. All right, my friends, let's meet our guest. Today's guest was the first MSL I ever interviewed almost 5 years ago on episode number 50 of the podcast. And I'm really happy to have him back with us to provide his insights and his advice about working in the pharma industry. So welcome back, Dr. Savi Chadha.
Thank you very much, John. Great to be here. Great to be back.
It's good to see you. And I have a lot to follow up on with you. And I know you were so helpful the first time we talked that this is going to be, I don't have too many guests that have been in pharma, a new job with pharma and moved up the chain and that kind of thing. Maybe at the most, it might be one other person. So I'm really glad you can help us today.
I'm glad I could do it. Glad I can be here.
Now, our guests, or I mean, not our guests, my audience can go back and listen to the original episode, but why don't you go ahead and give us the short version of your, what you were doing before you became an MSL and then, basically how you landed your first job, and then we'll take it from there.
Sure. Well, like I think a lot of your audience members, I was a clinician. I was going to the hospital, seeing patients. And I think like a lot of physicians these days, I was starting to lose some of my satisfaction with the work. The same frustrations that I think a lot of us have in terms of day-to-day patient care. So a friend of mine, actually, he had made the transition from clinical work into the MSL world. And he knew about my background. He knew that I had some business experience. Before I went to medical school, I actually worked in advertising. So he knew that I had some good relationship building skills. And so he introduced me to the MSL role. So after quite a bit of thought into it, I started doing more research into it. And eventually I decided to take the plunge. And I started interviewing, researching, interviewing, and networking was a big one. And eventually, back in 2016, I did land my first MSL position, and I've been working as an MSL ever since.
Excellent. So I guess looking back, just if you have any pearls of wisdom about getting your first MSL job, we're not going to spend a lot of time on that, but anything that you would put out there in terms of advice for physicians looking for that?
Yeah, I would, and this is a question I do get a lot. Getting an MSL job is plain and simple. It's a competitive type job. There are a lot of people applying. In addition to us MDs and DOs, PhDs apply, PharmDs apply, and now the field is taking more advanced practitioners, so nurse practitioners, as well as physician assistants. So it's becoming more and more competitive to get MSL jobs. That being said, as MDs, we certainly bring a wealth of knowledge and a lot of experience to that. So even though it is a competitive landscape, I encourage people to be confident in their interviewing abilities and their skills, and also to have a good amount of patience and fortitude, because I think most people I've spoken to did not get their first offer, or I should say, did not get their first interview, excuse me. And it was disheartening. So the trick, I think, for a lot of people is not to personalize rejection. Just maintain your focus, stay the path, if you will, and be patient and just be persistent. And I think in most cases, the people that I've talked to that have made it or that have succeeded have done that. So,
Well, I think, that is a job. You can't have an MSL degree or something that's going to say, okay, you're the perfect person for this job, from what I know. And you learn a lot. You learn when you're interviewing, you learn when you're looking at job descriptions, you learn. And I think it would make sense, correct me if I'm wrong, but to join the MSL Society, even if you're not an MSL, right? Because they have things that support people looking for that job, I believe.
they do, and I utilized them when I was searching, and I still work with them regularly. They have a wealth of information. So in terms of both about the MSL position itself, in terms of landing a position, interviewing, they go into a lot of detail. They're a great resource, fantastic resource.
Yeah, it's not like, looking for your first medical school job, not job, but getting into med school, getting to your residency. I mean, there's kind of a prescribed process for that, but switching to a new career like this can be somewhat scary and just the unknown.
It certainly can be. I mean, especially in healthcare, I think a lot of our career paths have a strongly laid out career path. And this certainly goes off that beaten path, and we're sort of treading our own way. So it can very much be anxiety inducing.
So now you've been doing this job in different forms for a while. So has it lived up to what you thought it would be? Would be of interest to us, I think.
I'd say, yeah, I would say it has. It's a very enjoyable, satisfying job in terms of being at the sort of cutting edge of clinical research. I get exposed to the newest treatments in my therapeutic area. I find out what clinical trials are going on for what new drug out there. So that's really fascinating, and it's really nice to actually be able to really have that excitement and enthusiasm, of a new product coming out to treat a disease. So from that aspect, it's certainly very satisfying, and I think that's always been there, and I foresee that always continuing to be there. That's just in the nature of the position. So
Now, from talking to yourself, I think previously, and others, I've heard that, it can have a fair amount of travel involved. It's just part of the job, although it can vary depending on whether you have a giant, territory or a small territory or what have you. So, but has that changed at all in the last 5 years? I know with the pandemic, there's a lot of non-clinical jobs where they're allowing them to do more remotely. So tell us what that's like right now for you, or has been.
That's actually a great question. And certainly the pandemic had a very significant impact on MSL's day-to-day activity. All of our in-person discussions moved online, like I think many people's are. Now that the pandemic is sort of wound down, a lot of us are back in the field. So we are meeting with clinicians and researchers in person. So that does require a lot of travel, which is very much similar to what it was prior, pre-pandemic. So it certainly has gone back to that model. Yeah.
Okay. I'm sure it varies by, again, the situation. So that's just something to remember. But now you have been, working there, and I know you ended up switching companies, and now you've got some different roles. So why don't you explain what's happened over those last 5 years for you?
Sure. Yeah, I think as I've been there at my current company longer, I've certainly gotten more projects and more type of administrative roles, given to me. And some of these things are projects like interviewing new potential MSLs, training new MSLs, and then certainly managing them as well. And then so those are some of the things that I do, in terms of my current MSL team. Additionally, I also go outside of some medical affairs and do other aspects, I should say, within medical affairs, excuse me, aside from just working with my MSL team. I also do work a lot with our promotional review committee. So any type of material that's printed, any type of advertisement that people see in terms of a pharmaceutical company or a product, I have to approve that and make sure that any claims that are made on there, specifically scientific claims or clinical claims, that they are backed up by clinical research and that they are 100% truthful. Additionally to that, I also do advisory boards. I put those together, and quite a bit of speaking engagements too. So in addition to MSL work, there's other projects, I should say, that I do.
Mm-hmm. Now, can you explain a little bit about how the medical affairs division in a pharma company is structured? Most of us, it's really a black box when we look in. It's like, okay, what the heck? I know an MSL might be in there. There might be medical directors, but what are they medical directing? So maybe you can give us an insight into either the way it's set up in your company and or other companies, if you're aware of how they typically, structure things.
Sure. I think one easy way to say it is, I think most people are familiar with pharmaceutical reps. They can go to physicians' offices. I think a lot of us know about them. And then pharmaceutical companies also have clinical research teams, entire research divisions. So I guess what we tell people and what I tell people is that medical affairs sort of falls somewhere in between those two divisions. And what I mean by that is, oftentimes, the clinicians will ask the reps questions that the reps may not have the immediate information on and may not be able to answer right away. So what they'll do is they'll say, let me refer you to our in-house medical liaison. And so we, as in medical affairs, work a lot with the current products that are already on the market. Whereas clinical research oftentimes will be working with products that are still in maybe phase 1 or phase 2 trials. So those products are usually not on the market as of yet. So what we can do is we provide medical support for products that have already been FDA approved and are currently being utilized by clinicians.
Okay, so if you had, I know the MSLs work with sometimes they're called key opinion leaders, or I don't know, what term do you use in your company for your contacts?
Across the industry, KOL, which is what you said, key opinion leader, that's the most common one, but different companies will use different terms. Some will say thought leaders, some will say stakeholders, some will say, there's a lot of different terms for it. So
okay, so in the way you're set up now is that anything that's been approved and is out there in the market, you definitely can have those conversations. But when it comes to having conversations about things that have not been approved by the FDA, that would shift to somebody else, or would that be something that the MSL could talk about as well?
that's actually a great question. And that is actually something that we MSLs can do. And because clinicians do frequently ask about the company and say, what products do you have in the pipeline? Can you tell us a little bit about them? And the commercial division and members of the commercial team due to legislation, are not allowed to speak on that. Whereas as in medical affairs, we can. So that's what I mean when I say that we're sort of a bridge between clinical research on one hand, as well as commercial on the other. We support the commercial, and yet we can also talk some about the clinical.
All right, because I was a little bit confused about that, but that makes sense, because you guys are really, it's all about education, right? And to your KOLs, and it's really not promotional at all. And the FDA doesn't like it if you ever do anything promotional on that side of the equation. So,
That is
but
correct.
you're strictly, by the book. And but if it's scientific, if there's evidence for it, you can just discuss it. From what I've heard.
That's correct. Yeah. If it's scientific, we absolutely can discuss it. Yeah.
All right. So now what would be so you've got a little bit more responsibility, it sounds like, in what you're doing. You've got some seniority. So tell us a little bit more about that, like, what other things you might be doing, how, if somebody is in a position that you were in 5 or 6 years ago, are there things they can do to help, get that kind of experience, and maybe what you're even looking forward to doing in the future.
I would say, if for somebody, for sort of a new MSL, if they're looking to advance their career, certainly being proactive, it goes without saying, as in most careers, being proactive about letting your manager know that you want whatever said task that that they have. Certainly stepping up and being a leader on your team is a big can be very useful to your career, and that shows initiative, that shows proactivity, and certainly, obviously, it shows leadership. So also, if you've managed, say, another employee or assisted another employee in terms of interviewing them, in terms of getting onboarding, those would also certainly be very useful, onboarding specifically.
Now, I think looking at your LinkedIn profile, I saw that you've actually taken some additional steps. I think you became board certified. And so what was that about? What was included in that kind of education? And did it have like leadership and management components to it, or was it all focused specifically on the job that you do as an MSL?
It's been a little while since I got my MSL certification, but from what I remember, it required a written examination that talked a lot about some of the different roles and some of the different aspects of being an MSL, and what MSLs are legally allowed to say and are legally not permitted to discuss, and how we can bring about those discussions. I remember the test had a lot to do with that, in terms of how we can appropriately bring about those discussions. The certification also required a certain amount of work experience at that point in order to receive the certification. So it was a combination of knowing, I would say, the job itself and what it entails and what it does not entail, and then having an appropriate amount of work experience already under one's belt, if you will.
Now, I have to assume at some point, some people in your position will end up getting even more into the management side of things, leadership and that sort of thing. I guess a couple of questions about that, if you know the answer. One is it beneficial or less beneficial to be a physician as opposed to, let's say, a PharmD or an RN or a master's nurse, or other specialties in terms of the leaders? Who do you see are the leaders? Is it more of the physicians or not necessarily?
It really runs the gamut, really truthfully. I mean, I look at the leaders, my managers, and I look at managers in other companies, and it really does run the gamut. I mean, there are some are MDs, there are some that are DOs, lots of PharmDs, certainly. That's simply because PharmDs make up the most MSLs, so inevitably
Okay.
simple math there. But there are PhDs. I've had nurse practitioners who who were managers, who were great.
Mm-hmm.
So it really does run the gamut. It really the degree is really secondary to people's both hard and soft skills once they get in. So
Okay. Darn it. I was hoping that, some of us physicians would have a leg up, but I guess as long as you're just, doing your job well and helping the company, helping your peers and so forth, you'll probably advance like anybody else. So at least that's good to know.
Sure, absolutely.
Let's see. Trying to think, and was there another question about, I guess trying to get a little more insight into the rest of the medical affairs division. I mean, you kind of explained this, and I guess the way I look at it, the medical affairs is kind of responsible for getting the new drug out into the world, I guess is how I look at it. But, I
Mhm.
see these ads for assistant medical directors, associate medical directors, executive medical directors. It's kind of nebulous terms. So is it just they just have more responsibility and a bigger scope of people reporting to them? Is that basically what that means? Or is there some other key that we should be aware of?
I think you sort of touched on it. An associate director usually will be joining the direct, maybe that's their first directorial level position. So they'll be labeled as associate and maybe not have full director type responsibilities. As they gain more experience, then maybe they become director and then maybe eventually senior director. So I think you touched on it. It's just really just the volume and intensity of the types of projects that they're given and told to manage.
All right. So let's see. I'll put you on the spot now a little bit, even more than I already have. So I'm
Uh,
just trying to think of other advice you can give to physicians or even other clinicians, because I do have some nurses and pharmacists and dentists that listen. But in terms of preparing for that first MSL job, but then maybe even learning some things prior to getting your first MSL job that might help you later on move up the ranks. Any thoughts or suggestions on that?
Yeah, I would say a couple of things. I would say to really talk to their drug reps that come to their offices or their hospitals. They are an excellent resource in terms of information and in terms of also just networking, a segue in. They can ask their reps if they speak to if they have a medical liaison that they work with. If so, ask to speak to them, get to know them. Um, yeah, it wouldn't hurt to maybe give them a copy of your resume if they're hiring. Who knows? Maybe they're hiring. That is an easy segue. That's kind of laid out right there. So I think that's something that's a resource that people have that's often overlooked.
Yeah, I've at least spoken with one person whose job came directly from talking to uh, the drug rep when they were still clinically practicing, and then actually just within a year she became an MSL. And it's like, okay, that worked out well, but that it's not always that simple. But you know,
If you're right, it certainly is not that simple. That being said, it is an avenue that's available. There are other avenues. I think that if that's an avenue that's right there, that's proverbially sitting right under the bed, if you will, might as well take advantage of it.
I think part of the issue was for her it was that she ended up um, some of her colleagues ended up being KOLs. So it was like it was built in. She became an
Mhm.
MSL and she was calling on those very people that she used to interact with. So I think the company thought this would be a good, hire, but it doesn't work like that very often from what I've heard.
Yes and no. I would say it can be an asset in terms of our professional network. It won't. I can pretty confidently say that that will not be the only network that FK was that she will talk to. She will certainly have to expand. But so
Yeah, and what are the odds that you're going to just happen to live in an area that happens to need an MSL who's not already working there, and for that company. But
mhm.
still, it's worth definitely you can learn a lot from your rep, from what I've heard. So I'm glad you definitely second that. So anything else that we're missing that we in terms of the job, applying for the job? Do you see a lot of your colleagues doing lateral moves to other companies, or do most people try to work their way up in one company and then later on do a switch?
I would say I would say generally I see a lot of lateral moves, primarily for a few different reasons. I think a lot of people, one is when they become an MSL, a lot of people are simply satisfied with the MSL itself. They don't have really intention or any interest in going into management, which is perfectly fine. In that case,
Mhm.
lateral moves happen more often.
Mhm.
Um, Generally, what I've noticed is that if somebody moves vertically, they do generally move vertically within their own company and then move laterally.
Mhm.
So it's not too common where I've seen somebody do both a lateral and a vertical at the same time.
Yeah,
So,
I think that's what we see kind of in different industries. Like when I was in the hospital environment, it was a lot easier for me to get kind of go up the chain. And then I never did this, but I had a lot of colleagues, and then they switched to another, hospital or health system to try and get a pay raise. Basically, was why they did it. But
mhm,
those things they're not easy because you got to travel, maybe you got to move. Who knows?
right,
So.
precisely. Yeah. Mhm.
All right. Well, I think I've picked your brain pretty darn well here for the last half hour. So, any words of encouragement you want to give to the listeners too? Because most of my listeners, are a big percentage, they've been trying for a while to get a non-clinical job, or they're just getting started. They're kind of frustrated working in the hospital situation or even a clinic situation with long hours and working with EMRs and the risk of being sued. Any advice for those people who are still maybe in that early phase?
I would say is don't lose heart. If you're persistent, I know it's hard because people oftentimes want to transition during very stressful times in their career and they want out pretty quickly. The transition does take time. I mean, most people I've talked to, it didn't happen right away. It takes months, sometimes years. So it's just patience, persistence, and fortitude. Don't personalize rejection. Have thick skin to work it through it. I would say. I know it's hard. I know it's not easy. I know that the very reason they want to transition is because they're stressed out at their current job, but it does take some time, regardless.
I think that's good advice, because when we're in a big hurry, sometimes we make mistakes that we end up being worse than the solution, that we would have gathered if we just gave it some time and really figured out what we wanted to do instead of run away from something. So that is definitely excellent advice. All right, Savi, this has been really good. It's been great to catch up with you, and we'll put it on the books to get back together in 5 years.
Thank you for having me, John.
And it's been great. And I really appreciate the time you've taken to come in and share all that with you. So best of luck, continued luck and success and your work in pharma. It sounds really good. So with that, I'll say goodbye.
So much. Appreciate it, John. Thank you again for having me.
I'm really glad Savi could join us today. I know that you are curious about the pharmaceutical industry, and Savi was able to answer a few more questions about the MSL role and about other jobs in medical affairs. You can find the show notes for today's episode at nonclinicalphysicians.com/medical affairs leader. That's nonclinicalphysicians.com/medical affairs leader. You'll have the show notes and you have links to some related materials and some old podcasts, including Dr. Chada's previous episode. Some of the links that I refer you to and that you'll find in the show notes are affiliate links. So that means I receive a payment from the seller if you purchase the affiliate item using my link, but the cost to you is the same either way. The opinions expressed here are mine and my guests. So while the information provided on the podcast is true and accurate to the best of my knowledge, there's no guarantee that using the methods discussed will lead to success in your career, life, or business. So always consult an attorney, accountant, or a career counselor, or career strategist before making any major decision about your career. Now, please join me again next Tuesday. I believe I will have time to finish editing my interview with Dr. Karen Barnard, an endocrinologist originally from South Africa who now coaches physicians full-time here in the U.S., and we'll learn her approach and find out how her clients overcome their biggest challenges. All right, can't wait to see you next Tuesday. Bye-bye.